Good morning. Good morning, everyone. Thank you for being here early on a Sunday morning, and welcome to this session on global health challenges. To all of us here on the panel, and I will introduce the panelists in a second, a key message is that global health and global health challenges are a political issue. And that is why it is so relevant, in our view, to the World Policy Conference. Now, we're very privileged to have a fantastic panel this morning, and I'll start from my left with the Honorable Maha Barakat, who is Assistant Minister for Health in the Ministry of Foreign Affairs of the UAE. And maybe we'll come back to that, but I find it particularly relevant that there's now an Assistant Minister on Health in the Ministry of Foreign Affairs. Next to her is Professor Jean-François Etter, who is an Honorary Professor of Public Health at the University of Geneva and a well-known specialist of tobacco and tobacco addiction. Next to him, Professor Antoine Flahault, whom you will know from previous WPCs, and who is the director of the Global Health Institute at the University of Geneva. And next, Yoshi Sakara, who is a senior research fellow at the Institute of Geoeconomics and the Asia-Pacific Initiative in Tokyo, Japan. And last but not least, Dr. Juliette Twackley, who is a distinguished pediatrician and who is here in her capacity as Mercy Ships International Ambassador for Africa. So we will have different perspectives, different geographic and thematic perspectives today. Let me start thank you. Yes, by first bringing back to this panel the issue of the COVID pandemic. If you remember, health came in the WPC in the very beginning of the pandemic, when Thierry de Montbrial organized a special session on the pandemic and its political and geopolitical relevance, which was a video conference at that time because of the circumstances. And since then, for 3 consecutive WPCs, 22, 23, and now 24, we are having a health session. And for those of you who were here in previous years, you will remember that in those sessions, particularly together with Antoine Flahault, also Maha Barakat, Juliette Twackley, we have been discussing a lot the state of the pandemic and its impact on geopolitics and on economy and society. So let me start from the pandemic this morning, because obviously, everyone has forgotten now about the pandemic. And so let me just remind you with a few facts. It's been the worst combined health and economic crisis in living memory. The global excess death toll is estimated to be 30 million people. At its highest point, 90% of children across the world were unable to attend school, which has profound consequences around the world. And at least 150 million people were drawn into extreme poverty, and it's been a major economic shock. An estimated 22 trillion of output is expected in the period of 2020 to 2025, which is much more than the financial crisis of 2008-2010. And the pandemic, even though quieter, continues to have profound consequences on our lives, particularly in poorest countries that are heavily indebted and are still struggling to recover, particularly from the economic situation. And then the last point, which I emphasized in red here, is that COVID-19 not only has somehow disappeared from our memories, our minds, our day-to-day worries, but it has dropped off the global political agenda. And this is a serious issue that I hope we can discuss in more detail. Let me remind you that during the pandemic, health and social systems have been under major stress. COVID has disrupted essential health services in 90% of the countries across the world. There's been stark inequalities in access to vaccines that left large parts of the world exposed to COVID-19. And there has been huge gaps in social protection that have resulted in widening inequalities. And that has been in low and middle income countries as much as in high income countries, for example, in the US, where the epidemic has been catastrophic, particularly because of the lack of proper social protection. And these inequalities, both in health systems and in social protection, during the pandemic, I believe has had profound implications until now for health, economic progress, trust in governments, social cohesion, and geopolitics. And I'll be interested to hear from the audience, but following in Geneva the negotiations, the ongoing negotiations on the pandemic treaty, I see them characterized by mistrust and a profound gap between, to make it simple, although I hate using that vocabulary, the global south and the global north, distrust, with the south saying never again, and the north sort of sticking to its positions. We'll come back to that a little later. But distrust, polarization, which we also see in our societies, and a lot of it has to do with the pandemic and its sequelae. There's been a number of assessments of what went wrong during the pandemic, including an assessment by the so-called Independent Panel for Pandemic Prevention, Preparedness and Response, on which I was privileged to serve, that was convened by the World Health Assembly in 2020 and worked for about a year throughout 2021. That panel and a number of other panels, including panels from academia, all basically agreed that averting another pandemic is a challenge that can be solved. And there's been a number of converging opinions of what would be the set of reforms needed. And that's what I'm showing on this particular slide. So everyone was agreeing somehow that we need better internationally agreed principles, rules, and obligations of states to prevent, prepare, and respond to pandemics. PPPR, in our language, is Pandemic Prevention, Preparedness, and Response. And that concretely means amending what is called the International Health Regulations. You've heard about the International Health Regulations. This is, for example, where how much WHO can come to a country where an outbreak is appearing to investigate the nature of that outbreak, how much WHO has freedom or not versus national sovereignty to investigate an outbreak in a country. That's part of the international health regulations. And then there was a suggestion that a binding treaty is negotiated on pandemics and pandemics preparedness, called the Pandemic Accord or Convention or Treaty. There's still no agreement on how will that be called, but very importantly, a binding agreement for countries, a treaty. Then, in order to address the inequitable access to vaccines and medicines that we saw during the pandemic, agree on a pre-negotiated system. Because what happened during the COVID pandemic is that everyone was taken by surprise and we had to adapt. So there was a race for vaccines that was, as you know, very successful, with about the same time, within a year, vaccine in the US with the mRNA vaccines that you know of, vaccine in China, vaccine in India, vaccine in Russia, then Cuba, a number of vaccines that appeared within a year or 14 months. And then there was a huge race for access to these vaccines. And the whole process was, we all agree, very messy. So there's a need to actually pre-negotiate in advance of a potential pandemic. How would the world proceed in this area? Then another issue has been the lack of funding. It took about 6 to 8 months for the World Bank to start disbursing its special pandemic fund in 2020. So we need to agree as a global community on a financial package that would, one, finance preparedness, and two, include surge financing in case a new pandemic occurs. And the fourth point is particularly important. It's about political leadership. And you may, I hope you will agree with me that we didn't see strong political leadership at global level during the pandemic. Every country sort of went its way. The UN were pale. So our panel had suggested that we design and establish what we called a Global Health Threats Council, which would be a sort of Security Council for health, not working, of course, on the model of the Security Council with a veto vote, but a sort of high-level heads of state or heads of government level council next or in the UN system. That suggestion has not been taken on, but as you may know, in the platform that the Secretary General had put forward this September, there is a suggestion for a platform, a sort of council, for everything that is not war and peace directly, climate, food, water, health, which is maybe the way to go. And finally, for monitoring and accountability, everyone agrees that we need something on the model of what is happening in the climate with IPCC. Now, this is a chart of progress. And as you can see, there's been little progress since 2020. This is an evaluation that goes from red to green. There's been some progress on country preparedness, some progress on new financing with the creation of a pandemic fund. I will not go in any detail here. Definitely some progress on surveillance and alert, because the international health regulations have been successfully negotiated in Geneva and amended, but no progress on accountability and basically no progress on political leadership. And as I said earlier, actually pandemics drop off the political agenda. And so my message here is that in 2024, the world is not ready for a new pandemic threat, and some of it became obvious with the Mpox pandemic that erupted in 2022, but with a new outbreak a few months ago in the Democratic Republic of Congo that spread to neighboring countries. This was declared a continental emergency by the African CDC and declared a public health emergency of international concern by the WHO in August 2024. We know that there are several 100 million doses of vaccine available in stock in rich countries for Mpox. And while the African countries and Africa CDC says we need at least 10 million doses urgently, at this time only several hundred doses have been pledged as donations by the EU, by the US, by Gavi, the International Alliance on Vaccines. So we're seeing a very similar picture to what happened in COVID in terms of inequities and delays in access to vaccines. I'd like to go back. I don't know how to do that. Never mind. Okay. Sorry. A few words on the treaty negotiations in Geneva. These have been now going on for 3 years, with 12 sessions of the International Negotiating Board, and they haven't reached an agreement. Originally, the deadline that was set was May 2024, then it was pushed to December 2024, now it's been pushed to May 2025, most likely, but no agreement could be reached for 3 years. And you may be surprised by this, since we thought that the world would sort of learn about how urgent it is to act and to come together. But the negotiations are not, although progress has been reached in the last few months, but still no agreement. And there are still very sensitive issues not resolved. For example, let me say, the EU wants an annex linked to Article 4 of the treaty, which is on pandemic prevention, an annex that outlines clearly countries' responsibilities to prevent pandemics. But the Africa Group is reluctant to agree to what would be costly responsibilities that they wouldn't be able to finance, and it wants in exchange an annex to a system promoting a system that is called Pathogen Access and Benefit Sharing, or PABS. What is PABS? Is that the Africa Group wants a preferential access in the future to any vaccine or drug that would be developed from the genome of a pathogen, or from data on a pathogen that they would provide when they identify a new outbreak. And of course, this is sort of anathema to the pharmaceutical industry and to the US and the EU at the table of the negotiating table. So at this time, my assessment is that negotiators are tired after 3 years, but the future of pandemics and somewhere the legitimacy of WHO are at stake here. But the new unknown, of course, is the US, because the next 6 months of negotiations will already happen under the Trump administration, and there's a lot of unknown there. Will the Trump administration withdraw from WHO and from the negotiating table? Or would they somehow be inflexible in negotiations on issues such as intellectual property or PABs? We don't know. So I've summarized this, what I see as key challenges to multilateralism in global health at this time, and I'm sure for those of you working in other areas, you will find very similar features. The problem is now the increasingly polarized political nature of global health agendas, what I call the clash of norms and ideologies, that is basically distrust in science and ideology prevailing on science, the rise of sovereignty and nationalism in the face of a world that is increasingly interdependent. For us in health, the power of global industries, the food, the soda, tobacco, we will come back to that, and an overall weak global governance. And the problem is that the probability of a new pandemic is high. It's not a matter of whether it will occur, but a matter of when. And this is a slide from a very recently published expert panel in the Lancet Commission called Lancet Commission 2050. And as you can see, it says that there is a 23% event that a pandemic of the scale of COVID will occur in the next 5 years. I let you read the other numbers. A probability of 80% within 25 years that something over 1 million deaths will take place. So to conclude, let me just make 2 points. One is that health is an important issue for the foreign policy agenda. Health is a geopolitical issue, and we see it every day in the negotiations in Geneva. And health is an issue of both hard, we're negotiating a treaty, and soft power. Health is key now on the security agenda. Under the Biden administration, global health was under a global security affairs department in the State Department. It's a huge issue on the international economic agenda of commerce and industry. It's an issue of social justice and human rights. And of course, it's an integral part of intertwined, interconnected crises and challenges that we face: food, climate, energy, water. And we heard yesterday from our Brazilian representative on the panel that it will be a key issue on the G20 agenda of the BRICS for the coming year. And I added there that for 3 years now, it's been on the WPC agenda, which is a clear symptom that it is indeed taken as something important for the foreign policy agenda. And what we are to cover in global health are a number of common issues that the world can only address by coming together as an international community. No one country can solve these issues alone. And I've listed some: pandemic prevention, preparedness and response, HIV, tuberculosis, malaria that are ongoing pandemics, polio eradication, antimicrobial resistance, increasing epidemic of obesity and type 2 diabetes, the social, economic, commercial, political determinants of non-communicable diseases, synthetic drugs that are now a common problem to the world, the digitalization of health, the role of AI and regulating AI for health, and the issue of global health governance. So with this, we will now would like to turn to the panel and address some of those issues.